Hi everyone, welcome back to iMumz Ask Me Anything session. Today we are back with another senior doctor to speak to you, and I'll just take 1 minute to introduce her, and then she will talk to you all about how you can have your delivery and pregnancy naturally. Dr. Dipanwita Banerjee, she's a specialist in the Department of Gynecological Oncology in Chittaranjan Hospital Cancer Institute in Kolkata. And at present, she is pursuing her postdoctoral degree in AIMS Delhi Gynecological Oncology. She has been actively taking care of women who have cancer. Uh, in the female reproductive system, and she's been actively writing, been very vocal about her passion for cancer. She's been spreading so much awareness. She's also the member of oncology committee of India. She has published various journals. I think the more I say, the more the lesser it is, ma'am, for you. Thank you so much for taking out time to talk to our users, and they're looking forward to your insights and your thoughts on natural delivery.
Thank you, Anashua. So it's my second time I'm doing this session, and I'm really looking forward to chat with very few the intelligent women who will be logging in here. So remember, ladies, that pregnancy is a physiological condition. It's not a disease. So it's your body is a woman's body is always ready, always after a certain age, ready to bear a child inside them. And so it's always the basic thing about going ahead with a natural pregnancy is to be calm and enjoy your pregnancy period. So that's a very basic basic thing for carrying ahead with the with any kind of pregnancy. Yeah, there are ups and downs during pregnancy. There are few complete complications which we doctors as doctors are there always to take care of them. But always remember that it's a physiological condition. It's nothing abnormal in it. Being pregnant or carrying a baby inside you is nothing abnormal, nothing to think, nothing to be worried about. Always keep an eye, always be careful, and enjoy your motherhood. It's a journey. It's not about the reaching the destination. It's about the journey when you are going ahead with your normal pregnancy. And always keep in touch with your doctors, with your obstetrician, so he or she will be there to carry to be with you during your journey towards motherhood. So Anushwa, will I be able to see the chats?
I'll actually have to take up the questions. I will just ask you one after the other. Now, Priyanka says, I'm very scared of normal delivery, though this is my second pregnancy. My first baby was preterm and it was a normal delivery. The normal delivery idea gives me anxiety. What do you suggest?
So first pregnancy, it is a bit difficult. A bit. I would not say that what difficult. It is. The female pelvis. It's tight, and when you are giving birth, so it kind of loosen up. So second pregnancy, don't be afraid, Priyanka. You are at a better place now. You are experienced, and your pelvis is already has experienced the one childbirth. So this time, I would suggest you go ahead with the normal pregnancy for sure. And it's it will be easier this time because your pelvis has already, your uh, birth canal has already experienced a childbirth. So now the tissues are a bit loose, and it will be easier this time. So you may have experienced a bit difficulty in your first pregnancy, but it will be easier this time. Be sure.
Definitely. Thank you so much, ma'am. Now, the next question is Nikita asking, what are your tips for normal delivery?
um, be comfortable, don't be scared about the pain. Labor pain is it's a kind of few minutes or few max few, hardly within an hour when the pain is at peak, and then you will experience a lifetime of you will have a lifetime of experience giving birth to a new life. And moreover, nowadays with epidural, the analgesias, the local the anesthesias we do the obstetricians use, so there it's almost painless, but still there is some form of stretching, some kind of pain you will experience, but it's worth, because the side effects of going undergoing a knife for a delivery is, the in medical term, in medical science, is it's not always about the birth of the baby, but the postpartum effects, the recovery of the mother is also important. So it's always better to have undergone a normal pregnancy, so that you can recover quick. The recovery is quick, the complications are less, and it's done. So it's always better to have a normal pregnancy. And don't panic, your obstetricians are there. It's almost, nowadays it's almost painless. So, but believe me, having a normal delivery is a most safest and most it should be the most desirable for a woman if her pelvis or the fetus is okay, or can carry forward with the pregnancy, with the delivery period.
Thank you so much, ma'am. Uh, so, another question I see here is, can a woman with gestational diabetes eat raw coconut? What are the effective ways to control sugar after taking insulin 2 times a day? It is still showing high reading. So, what are the effective ways for controlling sugar?
So it's about the controlling of sugar is, you have to increase the dose of the insulin, because when you are, once the pregnancy is over, most likely the insulin, the sugar level will also come down. If you are not already a pre-gestational diabetes, this having diabetes in pregnancy is called a gestational diabetes mellitus, where the only way to control, if you are taking a twice a day insulin but still it's showing high, have some advice from your obstetrician and increase the dose of the insulin. That is important. And regarding this the food and all, so food, yes, of course you have to take care of your food, have so much more antioxidants, the natural, the sprouts, the sugar free, means as much as possible sugar free food and all. So because diabetes, it's really is a it's a very difficult for the pregnant mother. During the pregnancy, if you are having diabetes, it's difficult, but insulin does control sugar very effectively. So, but always keep in touch with your obstetrician if your diabetes is not under control. That's very much required.
Thank you so much, ma'am. The next question, Archana says, my hemoglobin levels are low. Will it affect my baby's growth?
It depends what's the value of your hemoglobin level. Hemoglobin level should is desirable in normal Indian women. Archana, just trust me. In normal Indian women, majority of women are anemic. So it's around 10, 11 is okay. Though WHO suggests a higher value for being not being anemic, but in Indian women, the usually the hemoglobin levels are less. But if it's too low, yeah, it definitely affects the fetus. It depends what's value it is. If it's less than 7, in that case you have to think about the increasing your iron, but and also if less than 6, blood transfusion. And in a way, if it is low, it does affect the fetus, because it uh, the red blood cells which carry oxygen. So this oxygen does transfer to the fetus through the placenta, through the placenta. So if oxygen is less, the fetus will also get less oxygen. So in that case, it will be, difficult for the fetus to grow. So growth will be affected if you are not, if you are having a severe or a very severe anemia. So take good food
Hmm.
is required, and take adequate iron supplements.
Definitely. Thank you, ma'am. Now, Divya says, I'm in my 30th week and I'm suffering from PUPP rash. Any remedies, please?
Suffering from what, Divya?
PUPP rash.
PUP rash. Okay, so it's
Yes.
like, most of the time it's are you taking any anti-allergic? So it's most, as I said, as I started, it was my opening statement that this pregnancy is a physiological condition. It's not a disease, ladies. So most of this, and when a lady is getting pregnant, the immune system gets undergoes various changes. So if you are having some definite rash, or if you are it's affecting, or it's not leaving any scar or something, I would suggest you consult a derma. But most of the time, these rashes and all, it usually due to the alteration of immune system. And take some anti-allergics, and go ahead with this use some cold ice packs and also to take care of it. And so it's not very scary though. But if you are having some trouble, you do definite consult a dermatologist.
Thank you, ma'am. Now, Deepa is 30 weeks pregnant right now and 36 years old. So, previously she had a C section, but she says, I am energetic and active this time. Is it possible for me to attempt VBAC?
Yeah, it is possible if your current pregnancy is uncomplicated, if it's going normal till now. So you are at the higher end of the age group, but still it's nothing like that it's impossible. But what was the indication of your previous cesarean section, that is important. And so that your obstetrician will definitely will go ahead. But there is not an absolute no that you are not able to, you will not be able to undergo a VBAC. It totally depends on the previous pregnancy and previous obstetric history. So what you had gone through, or what was the indication of the last C section, that is important.
Thank you, ma'am. Now, there are a few people asking if there is a daily routine that they can follow for a natural birth, or any exercises that they should do for a normal delivery. Do you suggest something like that?
Light exercise, light walking, and the I would suggest, which actually I also did during my pregnancy. I have two beautiful daughters. What I did, that you don't you carry on with your daily activities. It's nothing, it's a God's gift. And it's absolutely healthy, absolutely normal thing. And don't panic, don't think much about it. Your body will definitely undergo a few changes which you will eventually be able to cope up and will able to adjust. Body is a, it's, you know, human body is a total surprise. So it will eventually cope up, it will eventually adjust it's on its own. And carry on with your daily activities till the time you are being able to do that, you know. After a certain gestational age, some women may feel that no, I cannot, so then stop. You are the master of your own decision. So if your body, if you are able to carry on with your daily activities, there are more chances that you will go for a natural birth. And the light exercises, walking, yoga, yoga, and daily activities, you are what you are doing, there should not be any change apart from doing heavy exercise or heavy weightlifting. Or if the pregnancy is not totally normal, if it has some medical complications, you do consult your doctor and be comfortable. You know, once if you are not comfortable with yourself, you will not be able to carry on with a normal pregnancy, normal uneventful pregnancy. You know, we do give less importance to our mental health. But you know, you have to, that's, this journey is wonderful, that psychological changes when on a woman undergo when during throughout her pregnancy. uh, so enjoy the journey. So it's up to you that how you are going to uh, cope up with your pregnancy, because it's a lifetime change there will be. But it's a accommodation, or rather adjustment of your body as well as your psyche. So be comfortable with your body, be comfortable with your pregnancy. And remember, there will is our body changes, there will be some look changes in the in your look, but eventually, trust me, it will go back to normal pre-pregnancy state after you deliver your child. But enjoy this journey. If you enjoy your journey towards motherhood, and with proper medical advice, your journey will be smooth.
Thank you, ma'am. Now, there are a few people with gestational diabetes. They also want to know, can they opt for normal delivery, or does the sugar level restrict their chances of normal delivery?
Diabetes in pregnancy is a bit complicated issue. Uh, it's not key. It's an absolute no that you cannot go through a normal delivery. But you know, it's that will be a very fine equation between you, your baby's weight, because in diabetes the baby become is tend to become large babies, you know, because of this insulin and all. So in that case, it depends that what's your baby weight, what's your age, and yeah, what's your previous pregnancy status, what's your last if you have undergone last childbirth. So everything, it's a fine balance between a diabetic woman, whether it is a she's diabetic beforehand, before she had conceived, whether it's a natural conception or an IVF conception. So there are multiple issues. So diabetes is a fine balance between undergoing a normal pregnancy, normal natural birth, and to know when to stop and when to go for a cesarean section. So it's not that it's not at all recommended. It is possible, but you have to be careful.
Thank you so much, ma'am. Now, many of us have heard about painless delivery and the idea of epidural. So now they want to know if it is a good idea, is it safe, is it effective? So if you could guide them a little on the whole epidural.
Yeah, it is effective for sure, because it's the most the intensity of pain, labor pain, is maximum in the second stage, when your whole birth canal stretches and it baby pops out. But epidural definitely is, it reduces that pain to a greater extent. And nowadays most of the the normal deliveries are through epidural analgesia only. So there are studies which says that there is a chance of a bit of prolonged labor if you are giving epidural analgesia. But trust me, it's most of the cases epidural analgesia does wonder. And at a peak of your delivery, there will be some stretching you will feel. But definitely it will the epidural analgesia will reduce your intensity of pain prior to that peak, and immediate after. So it's helpful. So nowadays normal delivery is always with under epidural analgesia.
Thank you so much, ma'am. The next question, Akansha is asking, it is my first pregnancy. I am 23 weeks right now. I have fibroid on the right uterine wall, which is 7 centimeters big. Is normal delivery possible for me? Should I directly opt for C-section?
So normal, the fibroid is pretty big, and Akanksha, your fibroid size is going to increase, baby. Just be prepared for that, because the fibroid is a hormone dependent tumor, and in pregnancy the hormone levels are already rising in many folds. So the size of the fibroid is going to increase. So if it's an anterior fibroid and 7 centimeter is pretty big. So um, there are few complications. There may be a few complications, because after the baby is born there is a normal uterine contraction which is hampered after, if you are having a fibroid. So I would suggest that you keep in touch with your obstetrician, and if it is not increasing further, if it is uh, most of the cases it increases, um, uh, you have to be careful about thinking about your natural the normal childbirth, normal delivery. You have to be careful, Akanksha, because 7 centimeter fibroid, so it's pretty big.
Okay. Thank you so much, ma'am. Now, next, Dr. Sanchita says, I have low-lying placenta parallel to baby's head, 4.2 centimeter away from internal os. I'm 31 weeks pregnant. Is normal delivery possible for me? I'm doing daily walk and stretching, but after doing squats, I feel pain in the left lower abdomen.
Uh, 4.2 centimeter is pretty away, pretty far, and once you are advancing towards your pregnancy, the once the upper lower uterine segment stretches up, so the placenta goes further up, away from the os. So at 31 weeks of gestation, you have to follow it up closely. And at present it's not key, you will not be able to deliver normally, normal vaginal delivery. But at the age of 36 weeks of your gestation, that the decision will be made. But most of the cases what happens, Dr. Sanjita, that the placenta goes up further once you are achieving towards your further pregnancy, further means gestational age. So it's not like that. It's at present difficult to, because 36 weeks of gestation, it will be decided upon. And for the pain and all, I would suggest for the pain and all, 4.2 centimeter is not that close. It's
Okay.
okay. You can carry on with your normal daily
All right.
activities.
Thank you, ma'am. Now, I feel this is a very important question. Ranjita says, is normal delivery common? Because maximum I see C-section everywhere. What is making people go for C-section?
It's a preference of the patient as well as the doctor, I would also say. So C-section depends. It's normal delivery is it depends on the which region of the country you are staying. I have seen means there is a propensity of going ahead with higher C-section rates in some part of the country and some not. So, but as an obstetrician, we do always recommend, if a pregnancy is normal, pregnancy is a natural conception, and it's going well, it has some pros and cons, but it's still going well and with less complications, it's always natural delivery is normal vaginal delivery is preferable over a c-section any day, anytime. Yeah, so it's not about that you can just choose a method of confinement through blanket treatment. It's like you have to individualize each and every woman, each and every mother who is going to be. So, like a pregnancy, who is a 40-year-old lady who has conceived through IVF pregnancy, or a lady who is at 29 years of age or a 30 years of age but who has 3 4 previous losses. So it always depends on the individualization of the case, and uh, both these scenarios we would prefer the to go for a c-section. Just, it's about the best possible care you are offering to your patient, and the patient or the woman, I would refuse the word to utter that patient, because pregnancy is a normal physiology. So for that, it's absolutely normal if it's a uncomplicated, or a pregnancy or antepartum period is well taken care of, is registered, is taking good care of her own, and at regular follow-up, and properly following antenatal advice. That's it's true for all. It's in even the doctors, the lady doctors who becomes pregnant, they are the it's been said that they are the worst patients. So patients should also, that doctor patient relationship should be in that position, that trust thing should be there, and you have to follow your doctor's advice to go for normal, uneventful pregnancy as well as uneventful delivery period.
Thank you so much, ma'am. Now the next question, Riddhi says, I am 7 weeks pregnant and I have headache. Is there a tablet that is safe for headache during pregnancy?
So if it's troubling you pretty, so you can take paracetamol 500 milligram if it's not you are not it's unbearable, or you can do some, it's not key you will directly always avoid any kind of medication, but it's better to avoid for first 10 weeks of pregnancy. But if it's troubling you, it's if it is hampering your daily activities, if you are not having any you are having any migraine or a high bp, that you have to check once. And if once in a while, if you are having a headache, once in a while you can take a paracetamol anytime, 500 milligram. It's the safest analgesic.
Thank you, ma'am. Now,
But you have to
Sureya's.
rule out that you have to rule out this high bp and uh, this any blurring of vision or a migraine.
Sure, definitely. Now, Sureya says, I got my periods on June 21st. How many? weeks pregnant am I right now, and when do I have to visit my doctor or get the ultrasound done?
So you are at your around 8 weeks of pregnancy, June 21 if it is. So you can go for a dating scan now, and usually we do advise early scan in 5 to 6 weeks to see if it is a if the fetal sac or the gestational sac is within the uterus or not, and if the heartbeat has appeared, so that you can do, and very well it's time for you to get your first scan done, because localization of the sac, the gestational sac, is important, and you can very well see that if the fetal heart activity should come by now, so if it has appeared or not.
Thank you, ma'am. Shruti says, can we take Zofar tablet every day until 9 months? Is it safe or not?
No, Zofar is not very not recommended. So every day Zofar, if you are having nausea, I assume that you are having nausea or some kind of vomiting for this pregnancy. Every day taking Zofar is not recommended at all. Visit your obstetrician. If you are having some nausea or vomiting, there are medications which you can take which are safe for pregnancy, but everyday taking Zofar is not at all safe, and I would not recommend this.
Okay. Thank you, ma'am. Uh, okay, somebody is asking, without epidural, is the pain tolerable of normal delivery?
It depends on how brave you are. As I said before, it's like it's individual choice. You are the master of your own body. So uh, some women I have seen, some patients I have seen, that they just touching them causes pain. So it totally depends how much pain threshold you can bear, but it is painful without epidural. But there also comes the thing that if you want to feel that pain, because it's a pain of enjoyment, if pain of motherhood, so if you can tolerate, it's up to you, baby. So you are your own boss.
Definitely. Thank you so much, ma'am. Now, Deepa says, my first delivery was C section because I did not get the labor pains on time. Now, after 8 years, I'm 30 weeks pregnant again. So, can she expect labor pains earlier this time? Or how
That
does this work? So, I am getting a lot of questions around VBAC, around people who've had abortions earlier. Can we also have, or I have an IVF pregnancy, can I have a normal delivery? I
as
have
I
a
said
teen
before,
pregnancy.
as I said before, it's about, it's doctors also some do face some kind of indecisiveness when you are choosing a woman for, if she is going for if she should. It's not about if she should undergo a C-section or a normal delivery. It depends. If you suppose girls, you think about it. If a lady with a 30 years of age but has a 3 4 5 pregnancy losses, as a doctor or as a as a friend, even, would you suggest her to undergo C-section, normal delivery? No. I think majority will of your answers will be no. So the same thing happens, it's like VBAC is not contraindicated. VBAC is absolutely can be done, but depends on individual case, depends on individual woman. Pregnancy is a natural event. Pregnancy is always a natural event. Yeah, the body undergoes changes. You are bearing a foreign body or another human being inside you, so your body is undergoing a lot of changes. But uh, eventually it will get adjusted. It will with some plus, with some minuses, your body will start responding to that another human being inside you. uh, so VBAC is totally depends on how was your previous pregnancy was. So there are lots of causes that you have not uh, felt or experienced labor pain in the last pregnancy, but that does not hold true for this pregnancy. So you may feel pregnant, you may feel labor pain, because every pregnancy it's separate, every pregnancy is different from another the previous one. So this baby may start having some changes to bring some changes to your uterus, to your body, or your body may react to in a different way to this pregnancy of yours, current pregnancy, that you may feel pain, labor pain, that you will be able to we will be able to understand. Keep your patience, dear, so that you will be able to understand when you are reaching towards the term. But VBAC is not contraindicated. There are situations where you can go for vaginal birth after C-section. But
Okay, ma'am.
individualization of each and every
Yeah,
patient is important.
I understood. How about MCDA twins?
MCDA twins, MCDA twins, it's always in twin pregnancy, always a C-section is preferable, because once it's a twin pregnancy, in twin pregnancy there is a tendency of having a premature delivery. So usually the babies are prematurely born, and depends on the position of the babies as well. So in twin pregnancy, usually cesarean section is preferable over normal delivery.
Okay, thank you so much, ma'am. Uh, Kalpana says, I'm 32 weeks pregnant and my breasts feel very tight. What can I do?
As I said, your body is undergoing a lot of changes, and your breasts are becoming ready to secrete milk for your newborn. So if you are feeling if you are having pain, or you are feeling some tightness, discomfort, uh, press your nips and see if there are milk coming out. So it's 32 weeks, means almost you will be ready in a few weeks to feed your baby. So and if it is, drain the milk, and if not, so you can wear a tight undergarment a size smaller than what regular size of your bra you wear, so that will help.
Thank you, ma'am. The next question, Divya says, I'm 9 weeks pregnant and my job is like in my job, I need to continuously sit and work. And it is also a little stressful. Will this cause problem in my pregnancy or delivery?
If you allow your stress to go over your head, it will. If you don't allow the stress to go over your head, it will not. So as simple as that, Divya. So always doctors always recommend, so you go ahead with your daily activities which we were I would suggest, in simple term, don't give so much importance to the to your pregnancy. Do your daily work, do your daily activities, live a normal life, and enjoy your journey. So nothing is merrier than becoming a mother. It's a Trust me, it's a life changing experience.
Thank you so much, ma'am. Now, Devendra is asking a question. My wife is 2 months pregnant and she started bleeding. We got to our doctor and she got us ultrasound and said all is okay and started giving HCG injections two times a week. My main concern is, should we get Rogam shot right now or at 26 weeks of pregnancy? She is bleeding lightly and spotting once or twice a day for the last 16 days. Please guide.
Rogam, is if she's bleeding continuously at 8 weeks of pregnancy, if your obstetrician is advising to go ahead with your Rogam, because there may have been some feto-maternal hemorrhage. So if your obstetrician is advising to go ahead with Rogam, you go ahead. And if she's bleeding continuously with HCG, I would definitely for last 16 days, if you said, na, Anushwa, she's
Yes,
bleeding for last
she's
16
been
days.
bleeding for 16 days lightly. Yes.
Lightly lightly go, but give a keep a close watch, and uh, some sort of feto-maternal hemorrhage, what we call it in medical term, if the mother is Rh negative, and a few tests are uh, positive. So in that case, if your obstetrician is saying to go ahead with Rogam, you should get your jab done, get your wife's jab done, and keep a close watch. And HCG is to support the uterus and support the baby. HCG is like injection you are getting, but keep a close watch.
Thank you so much, ma'am. Now, a few of us are asking कि a baby has cord around the neck. Now, this has become a common reason for C-section. So, yeah, Sucheta is saying, I'm 31 years old. It's my second delivery. First one was a normal one. But her due date is tomorrow. Baby is 3.5 kg and baby's head is floating, and there is also a loop of cord. So I had a false labor on Saturday, but there is no symptoms after that. What do you think? Like, will it be a normal
Yeah,
delivery?
so cord around the neck. You had a good chance to deliver normal, have a normal delivery, but it depends how much, So if liquor is good, the water is good inside your uterus, and but if it's how many turns are there on the neck of the fetus, that's important. So if it is around the week and head is floating high up, it has not yet been engaged, and due date is nearby, so it's a matter of concern. And you should go undergo a thorough pelvic examination, internal examination, and assess your pelvis for this fetus, for this baby. Now, every pregnancy is different, every baby is different. um, how your body will react to this pregnancy is different from your previous one, so don't compare. But once, if a lady has undergoes normal delivery in previous pregnancy, she has a better chance to undergo a second time normal delivery. But it's not always holds it not always holds true. So in this pregnancy, there must have been some complication. There may arise a few complications for which you have to go for cesarean section. So you have to be careful.
Thank you so much, ma'am. Now, Sahil is asking, I think, a question for his wife. Is it safe to drive and climb the stairs in the 34th week?
Not not very much harmful too, but keep a control that how many stairs you are going. Or what was your what was his first concern?
Driving
Climbing.
and climbing the stairs, like, can it be done?
Driving we usually do ask them to avoid, but it's better not to drive in the advanced cases. And climbing stairs is also not that it's contraindicated or it's absolutely not recommended. No, keep a control.
Thank you so much, ma'am. Uh, okay, so all the viewers, if you are waiting for your questions to be answered, I'm skipping a few questions because we've already answered them. So please forgive me. I'll share the link here and you can go and watch the session again after we are done. Or you would have already got your answer probably by now. Akshita says, I'm 8 weeks pregnant. This is my first pregnancy. I'm taking high fiber diet, but my stool is not proper. I have fissure already. How to get relief from this? I even passed blood.
Oh my, it's a painful condition, I'm sure. So, are you taking plenty of fruits and high fiber vegetables? I would suggest you go ahead with that first. And at your 8 weeks of pregnancy, the fissure will worsen. And there are iron tablets which you must have started now by now. There are some iron tablets which are less, which does not cause constipation, like ferrous bisglycinate tablets, which are useful. So ferrous, the iron salts, there are salts of irons which do not cause constipation. I would recommend that you go ahead with those iron tablets. And if take plenty of high fiber diets, take fruits, all types of seasonal fruits, and high protein diet. And if still it's not working, if you do require some form of medication, you can try ishabgul once in a while. Or even that, if you are not diabetic, so if there are lactulose syrup which are there in the market, which you can try once in a while, that you can. But lifestyle modification is the first option which doctor would suggest. So try those
Yes,
tips.
definitely.
Yeah, let's see.
Thank you so much, ma'am. So, I see your question here. I also get a lot of questions on this. So, Saloni is asking, can I eat melody candy and chips from time to time as I have cravings? I think uh, that
Yes, you
that
can,
basically.
Saloni. Yes, you can, and you should. Pregnancy is pregnancy is a totally normal event. I don't understand why you ladies are giving so much importance to this event. It's a life-changing event for sure. It's a lifetime experience for sure, and it's a journey. It's it's a wonderful journey towards motherhood. So, whatever you are having, or the what kind of craving, if it's a healthy one, and and it's doctors cannot say each and everything, so that you have this or have that. Melody candy chips, you can have it any time of your, but yeah, keep a check that it should not go beyond your cravings. It should not go towards addiction. Not only melody candies or chips and everything. You have to take a balanced diet. In first trimester, we do advise, having a less amount of Chinese food. That's a common conception, common advice which we usually give. Or because in we Indians have a different taste bud apart from from the Chinese, for the Chinese food, so any food which is using MSG salt as a content. So we do advise to avoid those MSG content, because in first trimester, first few weeks of pregnancy, the brain is also developing, so that MSG contains glutamate, which should be avoided. But it's not ki you are absolutely barred from having that. You have to keep a check on that, and you enjoy having whatever you are willing to have. No contraindication in most of the cases.
Thank you, ma'am. Prachi says, I'm 21 weeks pregnant. I have cervical length of 2.5, which is borderline. What should I do to take care and avoid complications?
You cannot do anything, baby. It's up to it's if your cervix refuses to be lengthy, you cannot do anything. It's not in your hand, and you are not responsible for that. So stop thinking about it. As I said, Anushwa, is that pregnancy is an event. It's a blend of having a healthy body as well as a healthy mind. You have to take care of your own psychological well-being, and you are the master of your well-being. So you stop worrying about unnecessary things. If you are having a cervical, have you tell me one thing, have you ever heard of having a cervical length? Or have you ever worried, or have you ever thought about what is cervical length? Never, na? So it's about after you are conceived, you have started worrying about it, that it's low. Yeah, it's borderline. 2.5 is definitely borderline. But can you do about it anything? No. You have to take care. If you have to, you carry on with your pregnancy. Start try to stop thinking about it too much, and if it happens, it will happen eventually. And but you have a good, you keep in touch with your obstetrician. Let the obstetrician do her his or her job. That's up to your, that's on your hand, but nothing more than that.
Thank you so much, ma'am. So, somebody says, I'm not taking any supplements and my food habits also reduced, and I've covered 5 months of pregnancy. Till now, nothing I feel. In the third month, I went to the doctor and everything was okay. I'm not able to feel baby movements yet. So, I think she's a little worried about it.
Yeah, don't worry about it. 20 weeks is the margin or the cutoff when you start having, you start feeling your baby. And if you are not having food cravings and all, don't worry about it. Be happy that you are not gaining much weight. And once the pregnancy advances, you will definitely, now is the time that you will start having craving, you will start having, you will be hungry more often, and you will start having your food. And if your appetite is reduced, but be sure that your weight is maintained and according to your pregnancy gestational age. That is important. Plus minus idhar udhar ka is does not matter at all. And for this, so if you have to take a balanced, healthy balanced diet, you have to take more amount of protein in your diet. And bus, nothing to worry about.
Thank you, ma'am. I see a question, I think, which you would really like to answer. So I'll take it up. What are the symptoms of cervical cancer?
Oh, cervical cancer is most of the time, it is caused by a virus, human papilloma virus. So that is about, that is the cervix is the mouth or the neck of the uterus, where in most of the women this virus, when the woman is after her sexual debut, she gets infected. It's a sexually transmitted virus. So 90% of cases this virus goes on its own. As I said, your body will clean it on its own. But if it persists in 90, more than 95%, in 90 to 95% of cases, that virus goes off. But if you're having, if it's persistent in 5% of cases, in that case it started, it's started residing on your cervix. It first it becomes a small tiny tent, then it becomes a uh, small house, then the virus goes into your cervical cells and becomes a bungalow. And surprisingly, if this thing persists, or even if you are infected with HPV, you will not have any symptoms until and unless that bungalow of HPV virus, which integrates or which goes inside your cervical cells, and your body takes it up, your immunity system reaches and it takes it up and started changing the cell morphology. So then you will, that cervical cells will undergo changes and towards cancer. That time only, but that this whole journey of getting infected with HPV and developing a full-fledged malignancy, it takes around 15 years. Trust me, cervical cancer takes around 10 to 15 years to develop. But within this 10-15 years, you will not have any symptoms. You will be totally asymptomatic. So after you develop cervical cancer, after anyone develops cervical cancer, there will be intermenstrual spotting. There may be features of irregular bleeding per vagina. There may be symptoms of postcoital bleeding after intercourse. bleeding, or cycles becomes irregular, or even patients, I have seen patients present with renal failure also, kidney failure also. So for this 15 years of that window with what we are getting, that is a time. Here comes the role of doing a cervical cancer screening. So you must all of you must have heard about pap testing, or HPV virus detection test. So all of you should undergo, all women of reproductive age group between 30 to 65 years of age should undergo regular pap testing or regular HPV testing. Even if regular pap testing is not possible, even if HPV testing is not feasible or not possible, you can ask your gynecologist to go ahead with VIA, or a visual inspection on acetic acid, or a VILI, visual inspection with Lugol's iodine test. So these are the methods of screening the cervix to see if any changes are there on your cervix. So pap testing at a 3-yearly interval, HPV testing at 5-yearly interval, or VIA or VILI stat when you are visiting your gynecologist's office. So these are the basic tests which every woman of reproductive age group should undergo, because cervical cancer, if it is not develop a full-fledged cancer, it will be asymptomatic. The women will not have any symptoms. So that is very much required and very much recommended. As well as that, HPV vaccine has also come in the market. So this HPV, against this vaccine against this HPV virus, all children between 9 to 15 years of age, all girls who has not undergone the has not started practicing sex yet, should receive this vaccine as soon as possible, after 9 years of age. 9 to 15 years is the age where we recommend, and more than 2 doses at 0 and 6 months interval, and more than 2 doses, 3 doses if it is more than 15 years of age group. All women should undergo this cervical cancer screening, because cervical cancer screening, if you are doing it regularly, if you are undergoing this regularly, you will be able to prevent this cancer. That is, cervical cancer is the one of the is the cancer, the genital cancer, which can be prevented through regular cervical cancer screening.
Thank you so much, ma'am. I remember you had said कि if constipation becomes too much, you can resort to Dufalac or some kind of uh, medication. So, is it safe to take it every day? Is something users
As I
want to
said,
know?
you have to blend it. You have to blend it with your lifestyle changes and your need for the medication. You will be the best judge to decide. You will understand better than anyone that how your body is reacting to it. It's not always recommended that you always every day you take Dufalab. You start doing this, start changing your food habit. Avoid foods which are constipating, avoid iron tablets which are constipating. As I said, that ferrous bisglycinate salt is does not cause constipation. And also, you have to be more proactive in having seasonal fruits, high fiber diet. And if it is not working, in that case, I would recommend that you visit your obstetrician, get your fissure checked, because it's a extremely painful condition. So get your fissure checked. So how in what state it is, that is important. And then you go ahead. If it is in a advanced stage, you have to take. There is no option left. So take care of your own body. Take care of your own well-being first. Then only you will be able to take care of your baby.
Definitely, definitely. Thank you so much, ma'am. I think we've almost come towards the end of the session. I will just take one question more. And to all the viewers whose questions, if it is related to normal delivery, I have this condition, will I have this condition, will I have it or not? So I have shared the link of this session, and you can go back and watch this. I think your question should be answered in this, but we've tried to take in as many questions as possible. Ma'am actually shortened her talk a lot so that she could accommodate more and more questions. So the last question, ma'am, how to know that the labor has started? I think this is something that would really help many of.
It's
So I thought we should.
yeah. So you will, every individual is different. So in some women, it may start with some form of lower abdominal pain or a low back pain. The intensity or the feeling of pain will be different from the normal pain of pregnancy which you usually have, because there is a change in the spine also when the pregnancy is advancing. So there have some pain, but which the labor pain is different. It's something, it will be a constant, or it will start with a low mild intensity pain which will come and go, and then it will increase in intensity, the pain severity will be more. So it will come as in a phasic manner. In some women, it may present with some blood mixed discharge through vagina. In some women, even if it is a second pregnancy, the labor duration is usually shortened in labor second pregnancy onwards. So there, you might feel some pain and straight away go into labor. And it depends. It usually presents with a pain which started increasing in intensity in a phasic manner, and with some form of uh, blood mixed discharge, which we in medical term we call it as show. So, and then eventually or gradually it is increasing the pain as well as the discharge. In some women, there is a rupture of membrane, so that watery discharge suddenly comes out, gush of clear fluid comes out. So these are the most or more or less the common features of undergoing a labor. But the head, as one of the viewers said, that my head is high floating. So the baby's head is high floating. So the head should be engaged, because in once the pregnancy advances, once the baby's head engages inside your pelvis, you will start having a pain, or having frequency of urination. It's repeatedly you are going to the loo to pass urine, or constipation, difficulty in passing motions. These are there. So these are the most more or less the common symptoms of having labor pain or undergoing imminent delivery.
Thank you so much, ma'am. Yes, okay, you are back. In between, there was an internet disruption.
Yeah.
Yes, thank you so much, ma'am, for joining us in your busy schedule. I think we've answered so many questions today, all varieties of questions, and you've beautifully said, just enjoy everything that is coming with pregnancy. So I think that is the takeaway for us, and should be a takeaway for all of us watching today. Like, we get so worried ki baby movements I'm not feeling, then somebody who is feeling baby movements, oh, I'm not able to sleep because of baby movements. So I think it is very very important that you understand that this is like a very special journey that you are going through, and just just flow with it. Like, I think that's what ma'am has
Yeah.
said. If it gets challenging, and if it is like really a heartburn or something that is really bothering you, then definitely meet your doctor, see if there's something you can do together to resolve it. But otherwise, it is important to stay happy, right, ma'am?
Yes, life is
Anything
all
you
about
want
ups
to
and
say
downs.
to them?
Life is
Yes.
all about ups and downs. It will never be, only ups and only ups. In that case, the life will be boring, isn't it? So
Definitely.
enjoy your journey. Enjoy your journey. Don't give so much You are not special. You are, most of the time you are common, and the complications or the problems you are having for your pregnancy is common. So there
Absolutely.
are very rare instances where the women may suffer from some rarity of diagnosis or rarity of symptoms which may have. That's why you have to team up with your obstetrician to exclude
Absolutely.
that.
I think having a good rapport with your doctor, I think you've said it since the beginning. That is absolutely important.
So
Thank you
don't give
so much.
so much importance to your pregnancy. Just enjoy your motherhood
Yes,
and towards the journey towards it.
definitely. Yes.
Thank you.
Thank you everyone for joining in. And please, if your questions are unanswered, please post it in the feed section. One of our doctors will revert to you within 24 hours. Thank you everyone and have a great evening.
Thank you.